Hello students, welcome to the session. This session will discuss about orientation to microbiology. The various outlines of this session include: first, we will see importance of microbiology and infectious diseases, its importance for the examination for the students, its importance for the patient care, and importance for the microbiology for those students who want to take microbiology as a specialty. The next outline we will discuss the art of studying microbiology. The second year MBBS students who read microbiology, the art of studying microbiology for other MBBS subjects, and also for the PGME aspirants, that is the postgraduate medical examination aspirants, and the importance of microbiology reading, art of studying microbiology for those who intend to take microbiology as a specialty. Then the next outline will discuss the importance of CBME curriculum, the new MCI CBME curriculum for microbiology, and how it is different than the old microbiology MCI curriculum. And at the end, we'll discuss how to use DigiNerve app for microbiology sessions. So let's start with the first outline: importance of microbiology and infectious diseases. You know that infectious diseases are plenty. There are so many infectious diseases which are prevalent in the world. Like some of the most important infectious diseases like HIV/AIDS, malaria, and tuberculosis. So these are called as ATM, or AIDS, tuberculosis, and malaria. These are the three important infectious diseases which are prevalent in the world. Apart from that, there are various endemic and pandemics which are going on in the world. The classical example is COVID-19 pandemic, which has happened in the recent past, and also it is ongoing. Other important pandemics include influenza H1N1 pandemic in 2009, Ebola epidemic in 2014. So all these are various important infectious diseases which are prevalent in the world. Okay. Apart from that, there are various other infectious diseases like typhoid fever, cholera, sepsis, diarrhea, UTI, hepatitis. So there are plenty of infectious diseases. So all these infectious diseases the patients are suffering from, and microbiology is the base by which the MBBS students will know what is the pathogenesis behind these infectious diseases, what are the various etiological agents which will cause these infectious diseases, and what are the various diagnostic modalities to diagnose these infectious diseases, and the treatment modalities available. So that is why the microbiology is so important for the MBBS students. So first we will see how microbiology is important for examinations. Like the second year examination. Second year examination, you know that microbiology will come as a very important subject in second year, where you will have a theory exam for 200 marks. According to MCI, there are 200 marks of theory exam, which will be divided into two papers. Paper 1 100 marks, paper 2 100 marks. Then you have practical for 80 marks and viva for 20 marks. So it's a very important subject in second year MBBS student. Apart from that, microbiology is also important for other subjects because you know that in PSM there is a very important component called as communicable diseases. So the communicable diseases in PSM is nothing but these are the infectious diseases which will be discussed in detail, especially the epidemiology part will be discussed in detail in PSM. So communicable diseases are around almost like 1/3 of the total content of PSM. So that much of importance is there for the infections in PSM. Apart from that, in medicine and in pediatric, infectious diseases are very important component. So if you are master in microbiology, then this subject will be a boon when you discuss, when you read the infectious disease part of medicine and pediatric, and also when you read the communicable disease part in PSM. So please remember that microbiology is not only important for microbiology subject, but also the infections are very, very important for other subjects when you read with. Okay, like the next we will discuss the importance of microbiology for PGME, that is postgraduate medical entrance examination. This is like next exam and NEET PG exam. At present, the NEET PG exam is happening. That is the National Eligibility Cum Entrance Test. This is the postgraduate medical entrance examination for the PGME aspirants. But however, the new curriculum batch onwards, that is the 2019 first year MBBS batch onwards, when they will be writing for the postgraduate entrance, the new name what they have given is called as next exam, NEXT, which stands for National Exit Test. So so this is going to become the postgraduate medical entrance examination for the a new curriculum batch onwards. So you can see the breakup here. The INICET, that is the Institute of National Importance Common Entrance Test. This is the entrance test which holds for AIMS, PGI, and JIPMER. All this Institute of National Importance entrance is happening at present through the common entrance test called as INICET. So in 2020, INICET, you can see that around 20 to 25 MCQs have come out of 200 in microbiology. And if you talk about infection as a whole, because I told you that infections are also discussed in medicine, in pediatric, in PSM, and also in various other subjects. So as a whole, infection, if you see, 30 to 35 MCQ out of 200 have come from infection as a whole. Also in NEET PG 2020, this is a National Entrance Cum Eligibility Test 2020, where you can see that 25 to 30 MCQs have come from microbiology, whereas as high as 50 MCQs have come from your infection as a whole. So that is the importance of microbiology for postgraduate medical entrance examinations. Of course, microbiology is a great role for the patient care, because the diagnosis of infectious diseases, it happens through the various laboratory tests conducted in microbiology laboratories. Apart from that, the treatment of infectious diseases, the antibiotic management of infectious diseases, there the microbiologists play a very important role. A thorough knowledge on microbiology will help you, will guide you to choose appropriate antibiotic for the treatment of the infectious diseases. And the most important application of microbiology in patient care is infection control, because after the COVID pandemic, we all have realized that infection control is the most important tool for prevention of transmission of infection in between the patient in the hospital. Various infection control measures like hand hygiene, personal protective equipment, all these will be taught in microbiology. So in nutshell, I want to tell you that microbiology has a great importance, not only for the examinations, second year examination, as well as for the postgraduate medical entrance examination. It has a great importance for the patient care, in diagnostic, antibiotic management, and in infection control. Okay, so now we'll see the importance of microbiology for those who intend to take this subject as a specialty. So you can see that there are various booming area of microbiology like hospital infection control, clinical microbiology, antimicrobial stewardship, then molecular microbiology, where the real-time PCR, all these are various molecular microbiology tool by which will diagnose the infectious diseases. So all these are the booming area of microbiology. So all those who intend to take microbiology as a specialty for them, these are the list of the booming areas which they can adapt as their practices. Okay, so you can see that there are various higher scope after you finish antimicrobiology, like there are DM courses available, fellowship courses available in various sub areas of microbiology, like infectious disease, DM in infectious disease, hospital infection control, virology, then then clinical microbiology. So all these are the subspecialty of microbiology, where there is a scope of doing higher studies. Okay, so those who intend to take microbiology as a specialty, they have various scope, like they have scope in teaching. Okay, they have scope in research, they have scope in diagnostic, they have scope in patient care. So all these are various scopes of microbiology which you will avail if you take microbiology as a specialty. And also another scope is in public health. In public health, microbiology has a great scope, like in vaccine industries. It can be diagnostic industry, it can be vaccine industry. In all these places, microbiology's role is a very important. And for public health, as an epidemiologist or as a clinical microbiologist, they have a great role in public health. Okay, so these are the various modalities. Another important role of microbiologists in the private practice. So if you want to do private practice as a profession, so please remember diagnostics in microbiology, it's a great boom in the private practice. You can see that after the COVID-19 pandemic, whoever were practicing microbiology, they started to do the real-time PCR for the diagnosis of COVID-19, and it was a very profitable business. So please remember that even for the private practitioners, microbiology is a booming area. So now we'll see the next outline, the approach, the art of studying microbiology. Here we'll discuss the art of studying microbiology for second year MBBS student, also for the final year MBBS students. Then we'll see the PGME aspirants, how they should read the microbiology, and of course those who are interested to take microbiology as a specialty. All these different category of students, how they should approach to study microbiology. First, we will see the art of studying microbiology for second year MBBS student. So you also realize that you have to do something called as target oriented labor. That is, if you do only studying without any orientation, without any aim, without any planning, like non-planned study if you do, then you will get somewhere around 30 to 40% success. However, if you do target oriented labor, then what you will see is the success rate will hike to as high as 70-80%, or with repeated revision you will have a 90 to 95% of success rate. So what is important, what you should know is, you should know where to read, you should know how much to read, and you should avoid reading those areas which are least important for clinically, and also which are least important for examination. So those areas you have to avoid. You have to focus on the clinically relevant areas, and also those areas which are frequently asked in the examination. Okay, another thing I want to tell you is repeated revision is the key behind the improved memory. Okay, so you have to have repeated revisions, and they say that repeated revisions rather than reading extensively without any revision, you should revise again and again rather than continuously reading extensively without any revision. Okay, so like for example, for the second year MBBS student, the zero revision, that is the basics of the revision, should start before the class. Before the class, you should open the book, you should at least see what are the headings of the class. So for that you should know what is the class you are going to have today. Most of the students will be blank, they will not be knowing what class is going to be taken place. So you should see your class schedule priorly, and you should open the chapter from the book, and at least the headings, at least the outline of the class you should see from the book. So that is called as zero reading. So that is the first reading what you have. After that you should go and attend the class, and after you finish the class, you come back, and on the same day you should give the first reading. You should read from the book on the same day, and then the second revision can happen before the internal assessment. The third revision can happen before the stand-up exam, and the major revision, of course, you have to do before the university MBBS examination. And of course, apart from that, there are a lot of mini revisions what you will have before your practical examination, before your tutorials, before your viva internals. All these you can have various mini revisions. So please remember, revision is the key behind increased memory and increased efficiency in the examination. We have done a viva among the MBBS students in the colleges, and we have found that with each number of revision, the retention of the memory increases, and the performance of the examination also will be increase with each reading. So you can see here for the low learner, first reading you will have somewhere around 10% of marks you score, whereas if you continuously if you give reading, then after 5 revision, even the low learner also can achieve more than 70%. And of course for the first learner, the achievement will be more than 80 to 90% you will achieve if you have frequent readings. So please remember, frequent revision is the key behind increased memory and increased efficiency in the examination. Now we will see what will be the study methodology. You should go anti-grade method of reading, or you should go retrograde. You should go anti-grade way of reading, or you should follow retrograde way of reading. What is the difference between anti-grade and retrograde method of reading? Retrograde method means what? Exam based reading. That means only the previously asked question you will be revising. You will not look into the other areas of the book. So this is called as retrograde reading. Whereas anti-grade reading means what? Book based reading. So you keep on reading the chapters from the book. You don't look into the exam questions. So both way of reading, they have their own loopholes. Okay, retrograde reading also has some drawback, anti-grade reading also has some drawback. Students always will be in dilemma that they should follow this way or that way. So the anti-grade way of reading has the advantage that you will cover the entire book, so you will not miss any areas, but it is time consuming. It is extremely time consuming, and if you don't stress on the exam based questions, then your efficiency, your writing skill also will not improve in the exam. Retrograde reading has the advantage that it doesn't take much time, because only the exam based question, the previously asked exam question you will be reading, so quickly you will finish. But however, it fails to cover the unasked questions in the previous examination. So those questions which are not asked in the previous examination, but those are important questions. If you don't read them, then you will take a huge risk in the exam. So please remember that the retrograde method of reading also has a poor long-term memory. So you cannot just adapt the retrograde base of reading. So what you do is you should maintain a perfect balance between anti-grade reading and retrograde reading. I'll tell you what you do. You should follow anti-grade reading. The first reading has to be anti-grade reading, but the subsequent reading, the pre-exam reading, should be retrograde reading, where you should focus on previously asked questions, as well as you should focus on the important questions which are not asked in the previous examination. So those important questions you have to stress more upon, so that you will perform well in the examination. So the DigiNerve app, what we are going to launch, this DigiNerve app, the microbiology domain in the DigiNerve app, it has maintained a perfect balance between the anti-grade reading and retrograde reading. How to read a chapter from microbiology, how a second year MBBS student should read a chapter. I told you that the first or the zero reading happens before the class. A good student, an ideal student, should at least look into the book before he goes into the class. He should have an outline of the chapter. He should see the major heading of the chapter, and a quick go through of the chapter he should do before he attends the class. After that, you will go to the class, you will attend the topic in the class, then you come back and you do the first reading from the book. You should read the theory book again after you come back from the class, and remember that reading should happen on the same day of the class. You should not postpone the reading. On the same day of the class, you should read from the book. You should make notes, you should underline, you should highlight the important points from the book, and then you should stress on the answers of the essay type of questions. The long essay or the short essay, expected long essay or the short essay, whatever is available in that chapter, those questions, those answers you have to stress thoroughly. You have to read the whole chapter, but you have to stress on those questions which may come in the exam. I repeat, it is not only the previously asked questions, it also should include all the important questions, regardless they have been asked previously or not in your previous batch university examination. After that, what you do is you should open the PGME entrance guide any of the PGME book, the postgraduate medical entrance examination book, MCQ book you can open, and you should start doing MCQs from that book, so that you will again have the important point of the chapters. It will become a revision for you, and the previously asked entrance MCQs also you would have done by that time. Okay, so that is what you do next. After that, what you do is you have to revise the chapter again from the book before the internal examinations, before the university examination. You have to revise again and again. So this is how you should read a chapter of microbiology. You should first come back from the class, then read from the book on the same day, and after that you should revise the PGME guide. You should do MCQs. Then you should again revise the chapter before internal examination, before the send-off examination, and also before the university examination. Always stress on the important courses, answers of the important courses. You should stress upon so that you will do well in the exam. You will memorize well the topics, and as a result you will do well in the exam. And you remember that you should always cover the must to know area, because must to know area is very, very important, because they say that 60 to 65% of the questions they come from must to know area. And if you do well, if you read the must to know area properly, then more than 50% mark you will score. So you will pass in the exam, because most of the universities the pass mark is 50%. So if you are thorough in the must to know area, then 60 to 65% of questions you can attend. So at least 50% mark you can score. Then you should read the desirable to know area, which accounts for around 25 to 35% of the question. So the desirable to know area you have to read next, and then if you have time, then you should read the difficult area, the nice to know area, which usually accounts for 10% of the total questions. So this will be the usual question distribution. Most of the questions in the university exam, it comes from must to know area. So you should target the must to know area first, then desirable to know area, then nice to know area. And if you cover everything, then your total score will go beyond 75%. So you will gain the distinction. You will easily get the distinction. Okay. So this is how you should read microbiology from the book, and don't forget to have a case-based approach. So you should always read the case scenarios. Essentials of medical microbiology, essentials of practical microbiology, and also the DigiNerve application. All these three formats we have given plenty of case scenarios. So you should see the case scenario, you should read the case scenario, then start reading the chapter. Then you will enjoy the more. Whenever you will go to the ward side, whenever you will go to the bedside for your clinical posting, you should see the infectious disease cases, then come back and read from the book. You will enjoy the more. You'll feel more lively to read the topic if you correlate the chapter with a case. Okay, so the case-based study is also equally important. Now we will see time distribution, how you should manage the time, because they say that consistent reading over long period is more important than long spell reading over short period. Some student, out of josh, out of excitation, out of determination, they will start reading long spell. After few days they will exhaust themselves, they will stop reading. So you should not do that. Out of excitation, out of josh, you should not start reading long spells, and then you'll become tired, and after that you will not read. That is not the case. You should read in short spells, but for a longer duration. I will give you a timeline how you should adapt to. In a normal day, you should read 3 to 4 hours. 3 to 4 hours after you come back from the class, you should read 3 to 4 hours. Those days, whatever theory classes have happened, you should focus on that after you come back from the class. And maybe for the weekend, you can read 5 to 6 hours. And before the exam, especially before the internal exam, the 2 to 3 days before the internal exam, you should read at least 10 to 12 hours per day, so that you will do well in the exam. And of course, before the university exam, you will escalate your reading. Maybe 16 to 18 hours of reading will be required in the last month before the university exam. So you should start slowly but consistently. Consistent reading is more important than long spell reading for short duration. Okay, and of course relax in between is very important. You must adapt to relaxation in between reading. You should watch movies, you should watch cricket, you should go out, you should go to parties. All this should be a part of your daily curriculum. It's not that you will only read. You should relax, because mental relaxation, if you give, the next day reading will be very effective. So you should sleep well. So sleep also is a type of relaxation. Okay, so all kind of relaxation you should do in between. And they say that you can use the relaxations as a mean of incentive. So so for example, if some cricket match you want to watch, so you can see you can fix that you will read this topic, and after that you will go and watch the cricket match. So that cricket match watching or that movie watching will become an incentive that you have to cover some topic, then you will go and watch the match or the movie. So so use the relaxations as a mean of incentive. Okay. So the next important is you have to choose the buddy wisely, the roommate, the study partner. You have to choose wisely. Both the student should be of same mindset, same mentality, should encourage each other for studying. So you have to choose the study partner wisely, because if the study partner is not compatible with you, then that leads to a chaos. So you have to wisely choose your study partner. So now we'll discuss methods to improve your memory, because many of you will complain that the way I used to memorize in my school days, in my 12th, now I am not able to recollect. So there are various ways to improve your memory. So most important is when you read, try to correlate the things rather than mugging. Mugging is the worst method of memorizing. You should never mug anything. Try to correlate the things. Try to correlate the before topic, after topic. Try to correlate with the class note and the book. So you have to correlate the things. Try to correlate between the case scenario uh, and the content from the book. So when you correlate and think, when you correlate the things and remember, that kind of memory will be long lasting. And you should do group studies, you should do couple studies if you are compatible, so that you will know each other and you will try to remember things better. Always when you do group study or couple study, you will try to speak to each other. Whatever you read, you can tell to your friend. Whatever your friend is reading, he can tell you. So by telling each other, the memory increases. See, if you read alone, then the problem is you will not be telling what you're reading. So that is the advantage of group study or couple study, and of course recalling everyday night. So if one of the method what I used to adopt in my 10th class is, after I come back, after I read for the whole day, before I sleep at the bed, I will try to recollect whatever I have read. So recollecting everyday night advantage is, like at on the same day you are recollecting. So on the same day, if you recollect, if you're not able to memorize, you see the book and then you try to recollect, then that revision is very effective, because you are giving the revision at the same day of your reading. So this is a very useful approach. You see whether you are compatible with this. And of course booster revisions. Booster revisions are very important. They say that you should give a booster revision not very late, that you will forget everything. So they say that you should give the booster revision before you totally forget the matter. Okay, so at short interval, at every 2 to 3 months gap, you should give the booster revisions. Not that you will read on the day of class, then the next reading will be before the university examination. If you do that, then that is not called as a revision. That is called as a fresh reading. So the booster revision you have to give before before you forget the total matter. Okay, mnemonics are good way of revising things, memorizing things, but you have to limit the number of mnemonics. You should not have so many mnemonics that you have to maintain a mnemonic to remember the mnemonics. That should not happen. Mnemonics are good, but it should be limited and very easy to remember. Mnemonics only you have to use. So next we will see that assessment. So dear students, you should regularly assess yourself, what you have read, what you have studied, whether you are able to memorize or not, whether you are able to translate that in the examination or not, that is important. So you have to regularly assess yourself. Do not assess your preparation right inside the examination hall or on the result day. On the result day, you will tell that, oh, I didn't get the distinction. I was thinking that my reading is good. Oh, I didn't do well. So that should not happen at the day of result or at the day of examination. You should regularly assess your reading on a daily basis, so that the assessment for the examination, that kind of situation should not come only. What I mean to say is, you have to assess yourself daily. Every day's reading you have to assess yourself. I told you that group study or couple study you can do, where you can tell each other what you've read, so that you know that you are able to memorize well or not. Or even self-assessment can be done by recollecting after dinner. After dinner, the next two. So one way of recollecting is, after dinner, don't read anything new. After reading. After dinner, before you go to bed, that 1 or 2 hours, just you recollect, just you revise what you read on the whole day, and try to see that whether you have memorized appropriately or not. And of course, grand test. You should give multiple grand tests. You should give the grand test at a national level, at a state level, so that you grand test is the place where you will know your level, your standard, as compared to other students. Okay, so if you do all that priorly, then in the examination you will know that how much you are going to perform. It will not be a surprise for you if you do very well in the exam, or if you don't do well in the exam. It will not be a surprise for you if you regularly assess yourself. Okay, so next we'll discuss is, be an early riser. Some of you are late night reader, some of you are early risers. So both things are good. If you are reading late night, or you get up early and read, both things are good. But studies have shown that early rising is having a better impact than late reading. As you know that Franklin Benjamin has told that early to bed, early to rise make you healthy, wealthy and wise. So please remember that early morning reading, whatever you read in the early morning, that is around 3 o'clock to 6 o'clock in the morning, those 3 to 4 hours, whatever you read, the memory cells are so fresh that the retention is maximum. Okay, if you plot the whole day, the 24 hours, if you plot into 3 hours ka segment, then they say that the early morning reading, that is the time where the retention is maximum. Okay, because there is no disturbances, there is because the late night reading, you will have disturbances, you will have friends, you will have TV shows, you will have parties, so all this will be dragging you. Early morning reading, only you, nobody else will be there, so it will be a nice, it will be a relaxed way of reading. The retention is much better if you read early. I am an early riser. I love to rise early in the morning. Whatever books I have written, everything I have written only in the early morning. So 2 a.m. to 6 a.m. is the time where I usually get up in the morning and I write the books. I'll tell you my tricks how I get up early in the morning. So what I do is, I put alarm. I put 3 alarms, and I keep the alarm away from my bed. So when the alarm rings, I get up. If I don't get up in the first alarm, then the second or the third alarm, I have to get up. And when I get up, I go and I brush, then I make tea, I drink tea, then I start reading. And what I do is, I don't start anything fresh. I always try to continue from what I have left from yesterday. So don't read anything fresh early morning. I mean, the reason is, always you will have a starting problem. So if you start a new topic early morning, then what will happen is, you will have starting problem and you tend to sleep again. So always you continue from the previous day, so that you will be in a flow, and the reading will be smooth. Okay, so this is my way of early morning rise. So you can see whether you can adapt to this and you can practice to this. So next, what is important is the last 50 days of reading before your university examination. They say that you have to accelerate near the slog hours, because whatever you read the whole year, that matters. Of course that matters, but the last 50 days of reading is something which is the most precious time for you, because whatever you will perform in the exam is the product of last 50 days reading, and last 50 days reading you should not waste a single moment. So at least 16 to 18 hours of reading you have to do every day. And again, you have to remember that you should not leave any chapter. They say that you should cover at least the important questions from all the chapter. Do not leave any chapter. Suppose one chapter you have completely left, then the must to know area also you would have left. So you don't do that. Rather than leaving one section, leaving one chapter, what you should do is you should cover the must to know area of all the chapters, then cover the desirable to know area, then cover the nice to know area. So never leave any chapter. Even if you have less time, at least cover the must to know area of all the chapters. Of course, sleep well in the previous night is very important. They say that the efficiency increases roughly by 10% if you have adequate sleep on the previous day of the night. And guys, don't forget the importance of time, because once the time is lost, it cannot be recycled. So now we'll discuss the tricks how to write well, how to do well during the MBBS exam. So the first thing is you have to read the question carefully in the examination hall. At least you should read twice, and if possible, then try to read loudly inside your mind twice complete question you would read, because many students they do mistake, because it will be asked that write down pathogenesis and laboratory diagnosis of typhoid fever. You will read only pathogenesis in the question and you will start writing the pathogenesis. You will miss the laboratory diagnosis. Okay, typhoid fever, typhus fever. So if you don't read properly, you will think that typhus fever, you will misread as typhoid fever. Okay, so hepatitis A would have been asked in the exam, hepatitis B you will write in the exam. So that you should not do. You read the question twice and then you start attempting. And of course, you have to answer specifically to the point. Don't write stories, because as an examiner, I will not like if the student will write 2-3 pages of stories without any specific point. So even if it is a short answer also is fine, even if you know less also is fine, but write to the point and don't write stories. So write in a bulleted fashion. You should write in a bulleted fashion, highlight, underline, okay, draw more flowcharts and diagrams, because all this will attract marks. Handwriting should be neat and clean, and of course don't write stories. I told you earlier, it will create bad impression. Write to the point and specific. Write answers in order to keep accidental skipping, because many students they will skip some question accidentally. So if you write in order, you will not skip any question. And of course, write legibly, neat and clean. Do not try, do not overlap or overwrite. All that you should not do. Okay. You should mention clearly the question number. Many students will write the answer but will not write the question number. So mention clean and clearly the question number. If possible, then in between the two answers, you can put one horizontal line which will distinguish between two answers. And of course, you can attempt those first which you know better, so that the answer skill will be better. And time management is very important. You have to divide the time into the questions appropriately, and you have to fix your time. Suppose you have 10 questions, you have 120 minutes. That means you should keep 20 minutes for revision, 100 minutes for 10 questions. So each question for 10 minutes. So you should time it properly. Every 10 minutes you should finish one question. So time management is very important. It should not happen that you know the answer but you have lost your time. So these are the various ways you can improve your skill during the MBBS examination. So now we'll see the art of studying microbiology for the other category of student. First is for pre-final and final year MBBS students. So as I told you that infectious disease is a very important component for PSM in the form of communicable disease. So infectious disease is also important component of medicine, surgery, pediatrics. So what you do is you have to revise microbiology. A thorough knowledge of microbiology will help you a lot to read infectious disease in the other subject also. And of course, for the PGME preparation, I told you that most of the questions in the PGME entrance, they come from essentials of microbiology, because essentials of microbiology, the references we have taken from various important books like Harrison. Harrison is a book which is Bible for PGME entrance, and the infection part of Harrison is around 2000 pages in Harrison is about infectious diseases. And essentials of medical microbiology we have written, which has been adapted from Harrison. So the MCQ point of view, for the PGME entrance point of view, essentials of microbiology is of great help. And of course, I told you that the various PGME entrance, like the INI-CET exam, we can see that 20 to 25 questions have come from microbiology, 30 to 35 questions have come from infection as a whole. So if you're good in microbiology, you can write the infection related question from other subjects also. Like for example, in NEET PG, as high as 40 to 50 questions have come recently from the infection related MCQs. So all this you can attend better if you have a thorough grip in microbiology. And of course, those who intend to do microbiology as a specialty, for them they have to give more weightage for the bedside learning than bench learning. The microbiology specialty, if you are doing MD microbiology, then you have to give more importance for the bedside learning in addition to the laboratory learning. You should go and see cases after the reporting is over. You should go and see the cases. You should give antibiotic advices. You should see what antibiotic the patient is getting. According to the culture report, you should give the appropriate antibiotic advices. So these are the guidelines. These are the tips how to read microbiology, the art of reading of microbiology for various category of students. So now we'll see the new MCI curriculum. We'll see the new CBME based curriculum for microbiology. So you know that from the 2019 batch onwards, the new curriculum has been implemented, which is called a CBME curriculum, or competency based medical education curriculum. Earlier to that, the old curriculum was there. Now the new curriculum has been introduced. So the new curriculum differs from the old curriculum in various ways. All the subjects, it will be different. For microbiology, the curriculum changes are tremendous. I'll tell you the differences, what is there in the new curriculum. First is the approach. Microbiology traditionally was studied as organism-based approach, where we used to read bacteriology, virology, parasitology, mycology. All these are various components of microbiology what were studied. For example, HIV we used to discuss under biology, whereas Staphylococcus, Streptococcus, all this we used to discuss under bacteriology. But the new curriculum says that we will have system-based teaching, where we will read the infections pertaining to various systems, like for example CVS infections, respiratory infections, and so on. So this is a mega change. This is an abrupt change which is introduced in this curriculum. So the student must adopt to the system-based teaching, and it is very important for the student to read the appropriate book for the system-based teaching. So duration also is different. Earlier the second MBBS was 18 months. In the new curriculum it is for 11 months. Microbiology hours of teaching was around 240 to 260 hours earlier. Now the hours are reduced to 190 hours. The next is the competency-based teaching. The competency-based teaching was not there earlier. In the new curriculum, the competency-based teaching was introduced. What do you mean by competency-based teaching is, MCI has classified each topic of microbiology. It has assigned various competencies. So this is a snapshot of the table of content of essentials of medical microbiology, where we have prepared this book according to the MCI competencies, so that it is exactly according to the CBME curriculum. So you can see that these are the various MCI competencies which MCI has allotted to the various topics, and our book we have prepared according to the MCI competencies. Okay, next is the teaching learning methodology. Earlier, the lecture and the practical classes used to be the two methods of teaching. In the new curriculum, there are several other way of teaching. For example, theory and practical. Of course, it is there. Practical is been renamed as DOAP sessions. That is do, observe, assist, and perform sessions. So the practical sessions are converted to DOAP sessions, that is do, observe, assist, and perform sessions. Apart from that, the other new way of teaching introduced include SDL or self-directed learning sessions, where the students are expected to read by themselves the chapter at home, then they should attend the class, so that inside the classroom only we will have a revision in form of MCQs, in form of student seminar we will have revisions. So this is a new way of teaching, SDL or self-directed learning, where the student have to read the topic at home and then come and attend the class, and in the class we will have MCQ tests or we'll have MCQ based discussion, or maybe student presentations. So it's a kind of self-directed learning where the student will read by self-motivation. Then the small group teaching, the various small group teaching were introduced. You can see here the theory class hours are restricted to 70 hours, practical class hours are restricted to 40 hours, self-directed learning has been restricted to 10 hours, and the remaining all are given for small group teaching. Okay, so more number of small group teaching have been adapted by the new curriculum. And of course, you have integrated lecture where 2-3 different speciality will come together and will teach a topic. For example, tuberculosis treatment part will be taken by pharmacology, the pathogenesis part will be taken by pathology, and of course the laboratory diagnosis part will be taken by microbiology. So all these three departments will join together and will take a integrated lecture. So all these are various type of lectures, all these are various type of teaching learning methods which are introduced in the new curriculum. And you should also know that the assessment, because the approach is now changed from organism based to system based, therefore the assessment also will be performed based upon system based assessment. So you will have system based assessment where you will have 2 theory papers, 200 mark, 100 mark is each theory paper, then you have practical for 80 marks and viva for 20 marks. So this is the change in the MCI curriculum, in the new curriculum what has been introduced. And skill certification has been introduced. They say that there are various exercises like the staining technique, like the gram stain, acid fast stain, then stool examination, and various hospital infection control exercises like, for example, hand hygiene, donning and doffing of PPE. All these the students should perform by themselves, and after that the microbiology department will certify the student, will give the certificate the student that they are skilled in these techniques. Okay, so this is called as introduction of certifications in the practical classes, which was not there in the previous curriculum. So you can see that the new curriculum, it differs a lot from the previous curriculum. Especially for microbiology, it's a huge difference. The reason is we have system based teaching now. Earlier we used to have organism based teaching. So now we'll see how to deal with institute specific syllabus. The organisms are distributed into various systems. In essentials of medical microbiology, we have distributed the bacteria, viruses, parasite and fungi into various systems. So what happens is, suppose in some institute, if they teach the organism under a different system, for example, organisms which will affect multiple systems like enteric fever, typhoid fever. Typhoid fever basically it will cause bloodstream infection. However, the mode of infection of typhoid fever is by enteric route. We have discussed enteric fever in bloodstream infection, but some institute, because the mode of transmission is by enteric route, they may discuss enteric fever in GI system. So you should not get confused if that happens, because HIV/AIDS again we have discussed under bloodstream infection in our book, because it will cause systemic disease. Dengue also will cause systemic disease. All these three diseases we have discussed under bloodstream infection, but some institute may discuss this under various systems, like for example HIV, because the mode of transmission, they may discuss HIV in genitourinary infection. They may discuss dengue under arthropod borne infection because it is transmitted by mosquito. So in such situation you should not get confused, because in Essentials of Microbiology we have given something called as organism wise reference list. We have given something called as organism wise reference list. Here is the snapshot of this. You can see here the various bacteria, viruses, all these in a sequentially we have listed, and we have written down which and all are the chapters where it is discussed. So suppose if some organisms in your institute will be discussed under a different system than what is given in Essentials of Medical Microbiology, what you can do is you can refer this organism based reference list, and you can go to the particular chapter and the page number, and you can read from the book. Okay, and of course the assessment also, you have to follow the college pattern of assessment. So the organism assignment, what is done by your individual colleges, that pattern of assessment you have to follow. You have to read the organism under those systems for the assessment in the examination. So now we'll discuss how to use the DigiNerve app for microbiology. So we'll first see the authors. There are three important authors in DigiNerve microbiology course. Myself, Dr. Apurba Sastry from JIPMER, Dr. Sandhya Bhatt from PIMS, Pondicherry Institute of Medical Science, and Dr. Dipashri, she is from JSS Medical College, Mysore. So we are your three authors, three faculty for this course. We have taken the classes for this course. We have extensively taken the class. Almost 150 hours of classes are taken by us, and we have taken in a way that it will be helpful for you for the CBME based microbiology curriculum. We have taken exactly according to the requirement of CBME based microbiology curriculum. First, we'll see how the content are classified. So you can see that the content classification in DigiNerve microbiology is according to Essentials of Medical Microbiology book. We have taken 11 modules or 11 sections, which comprise of 81 sessions, and these 11 modules in this app are equivalent to the 11 sections in the microbiology book, and 81 sessions are equivalent of 81 chapters of Essentials of Medical Microbiology. Okay, so these are the various modules you can see here. These are the 11 modules, general microbiology, immunology, and so on, and each module has got certain sessions. These sessions are like chapters of microbiology book. Okay, so these are the 11 modules and 81 sessions. So these are taken, this distribution is exactly according to Essentials of Medical Microbiology. So now we'll see what is the composition of each session. Each session is further divided into a video session and a practice MCQ session, and also the notes. So now we'll see the composition of each session. Each session is comprising of a video lecture, an MCQ module, and also notes. So these are the three components of each session. Okay, video, practice question, and notes. And suppose if some sessions are bigger, for example tuberculosis or COVID or maybe influenza, for all the bigger sessions we have multiple video sessions. Multiple videos are been split up so that it not be a over exertion onto your brain. Okay, so this is the content classification. So now we'll see how you will operate the app. You have to first download the app in your mobile. You have to go to the Play Store and download the DigiNerve app, app in your mobile. After that, you have to do the login. After you log in, you will have a dashboard. In dashboard, you will have my courses. So if you subscribe to microbiology, then when you click on my courses, then the microbiology content will be opened. So as I told you, we have 11 modules. So the first two modules are been displayed here, like the general microbiology, immunology module. So whichever module you click, the sessions under that module will be opened. For example, if you click on general microbiology, the various sessions will be opened. One of the session has been opened here, like the physiology of bacteria. So you can see that three things are there here. The video module of physiology of bacteria, then you have the MCQ part, and also the notes. So first you can see the video. So you can play the video, or you can download the video locally into your app, like how you download in your Amazon Prime or Netflix. Similarly, locally you can download in your device, and then you can start watching the video. So you can play the video, you can watch the video. So you can see that the entire content we have taken mostly on a writing basis, on a writing skill, because we want the student to be attached to us while we take the session. So we have used more of writing, less of PowerPoint, so that the understanding will improve. So you have to keep making notes in your book also, side by side if you want. Then what you can do is you can adjust the pixel based upon your internet connection. You can also adjust the speed of the video based upon how fast you can learn the video. So you can adjust the speed, you can adjust the pixel. All these are various features of the DigiNerve app. Okay, so now we will see how to read a chapter from the DigiNerve app. So what you can do is, first you have to read the chapter from the book. So what you can do is, first you have to read the chapter from the book. After that, you have to watch the DigiNerve app, and while you watch the DigiNerve app, you can make notes. You can underline in the book. You can add bookmarks for the important topics, what you feel like. And then after you watch the video, you can do the practice MCQs to assess how much you have learned, how much you have memorized. After that, you can watch the other chapters in the same fashion. When all the chapters of the module is over, you can do something called as module test. Module test comprises of the MCQs from various chapters of that particular section of that particular module. So you can do the module test to know that how much you have retained. So this is how you should read a chapter from the DigiNerve app. So now I'll tell you the differences between the classroom reading and the DigiNerve reading. So in the classroom reading, there is no scope of revision. Once you attended the class, if you want to re-attend the class, you can't do that. Whereas in DigiNerve app, you can revise the topic as many times you wish. And you can make notes very nicely in the DigiNerve app, because you can slow down. You can start making notes. In classroom, making notes is very difficult unless the class is taken slowly by the teacher. And of course, a method of teaching. Most of the classes, undergraduate classes, PowerPoint teaching is the method of teaching what happens. But here we have taken more of a writing way of teaching, a more of interactive board based teaching, so that the eye-to-eye contact, the interaction will be better, understanding will be better. And of course, if you are absent or if you come late to the class and all that, then you miss the class. But DigiNerve app, you can watch anytime, anywhere, and any number of revisions. There is no practice MCQs provided at the end of the class, whereas in DigiNerve you have practice MCQs. And of course, different faculty take the subject for you, and some of the classes are good for you, or some of the classes are bad in your colleges. Whereas in DigiNerve, you will be taught by the renowned faculty to whom you trust, and whose books you read for your MBBS microbiology. And then the book references. So the teacher in your colleges may refer any of the book they want, but here in the DigiNerve app, the references have been taken from Essentials of Microbiology, which is the standard book for the CBME microbiology. Okay, but I want to emphasize here, you should use the DigiNerve microbiology app not as a substitute to your classroom study, but in addition to your classroom study, you should use this app. In addition to the classroom study, you have to come back and you have to read from the DigiNerve app. Okay, don't use as a substitute, but a addition to your classroom studies. So now we'll see the features of DigiNerve microbiology app. So as I told you, you will have speed control. So based upon your way of reading the app, like if you're a fast learner, then you can keep the speed fast 1.5 or so. If you're a slow learner, then you can keep the speed as 1.0, or if you're a medium learner, you can keep the speed as 1.25 in your first reading. Whereas subsequent reading, you can escalate the speed what you want. At that speed, you can see, you can do the pixel adjustment, you can have MCQs at the end of the session. So the practice MCQs you can do at the end of the session, which by which you can memorize faster. You can know that how much you have memorized. You can assess yourself by doing the practice MCQ. You can do the module MCQ, which will be done at the end of the module. So here the sessions are taken according to the essences of microbiology, the book of reference, what you all read for the MBBS microbiology. And of course, here you can do bookmark also. While you watch the video, you can do the bookmark, the important topics you can mark, so that you can revise this topic at a later date. Quickly you can access the topic, you can revise faster at a later date. And of course, the video indexing has been done for example, typhoid fever. We have done the video of the typhoid fever. We have done the indexing into the etiological agent, pathogenesis, lab diagnosis, treatment. So these are the various segments of the video. We have done the indexing, so you can go quickly to any of this part and you can directly watch. So it'll save a lot of time. Okay, of course, other functionalities are there, like resume video, restart video functionalities, that you can give feedback after you watch the video. So all these are various features which are available in the DigiNerve app. So now we see the usefulness of the DigiNerve app for the students while they read microbiology. So as I told you, the entire DigiNerve app for microbiology has been designed based upon competency-based MCI curriculum. So the CBME curriculum has been followed here, completely adapted here according to the essences of medical microbiology book. And of course, 150 hours of teaching we have done, 150 hours of lectures have been made, and all kind of teaching learning methods are adapted, like lectures, SDL sessions, self-directed learning sessions, and small group teaching, and practical sessions. All kind of sessions we have taken. And of course, our practical sessions also we have taken for 10 hours. So these are the various practical topics we have covered in DigiNerve app. And of course, organisms are covered according to essences of medical microbiology. So this is one more advantage. The book what you read, the same pattern of video you watch here, so it will correlate with the book. Classroom study may not correlate, but here you will have 100% correlation. Of course, organisms are covered in the system which is most relevant for that organism. Like for example, typhoid fever we have discussed under bloodstream infection. However, we have provided an organism wise reference list also. So if in your institute the organisms are discussed under a different platform, under a different system, then you can refer this list and you can go back and you can read from the DigiNerve app. Okay, so these are the various usefulness of the DigiNerve app for the microbiology students. So now we'll see the other usefulness of this app. So this microbiology or DigiNerve app will be useful for all kind of learner, low, medium and fast learner. You have to use this app in addition but not a substitute to the classroom teaching. It will be helpful for those students where the classroom teaching is not effective. Okay, it will be a great help for the PGME preparation also. And if the CBME curriculum based teaching is not effective in your institute, in your college, in your classes, then also this app will be of great help. You cannot take help from your seniors. The reason is the seniors, the microbiology has been studied according to the old curriculum, organism based curriculum, whereas for you it is new curriculum. So DigiNerve have will be like your senior, will be like your guide who will mentor you how to read microbiology. And of course you will have authors support in all the formats, like in the form of forum, in the form of doubt clarification, mail, live session, various kind of tests like grant tests, certification tests. All these we will be conducting, and we will be in touch with you. You will be communicating with the authors directly or indirectly through all this means, so that your doubts will be clarified from time to time. So the take home message is, in this session we have discussed the importance of microbiology for the students, for the patient care and all. Then we have discussed the art of studying microbiology for the MBBS student, second year MBBS student, and also for the other year MBBS students. Then we have discussed the CBME curriculum for microbiology, the new MCI curriculum, and how it is different than the old curriculum. And then we have discussed the DigiNerve app for microbiology, the various features of this app, the various usefulness of this app when you study microbiology. I hope you have enjoyed the session. Thank you.